Hey there, Dr. Brian McKay, not just a chiropractor, Stanfordarian, Norwalk, Buchanan. Yeah, I think we got all of them. All right, listen, we're heading into the final week of July. I'm sorry, of June. And headaches, it astounds me how many people don't really understand headaches and basically how effective chiropractic care can be for headaches. It's almost a crime because people out there doing Botox, doing all kinds of crap. And listen, if you have headaches, go see a chiropractor. I'm cutting to the chase here. Go see a chiropractor. If you don't see improvement within 4 weeks, then it's not the right thing for you. But at least you tried something. People go for Botox shots every single month of their life. Well, it's pretty much as long as the insurance company's paying for it, because it costs about 5 or 6 grand to do that. So it's not one of those things. So if you're suffering from headaches, let's go over 6 compelling reasons why a chiropractor could be the solution you've been looking for. All right. Headaches are a common ailment that affects millions and millions of people worldwide. Also happen to be my favorite thing I like to treat. So when most people rely on over-the-counter painkillers to alleviate their symptoms, or they resort to, they'll sometimes do beta blockers. They'll do like I said, the Botox seems to be the the rage, and it doesn't really work. People still get headaches. It's just, you know, I don't know. And the Kardashians are promoting, certain headache remedies. I get skeptical. But anyhow, so chiropractic is a natural way an effective way to alleviate headaches. All right, it's non-invasive, it's drug-free approach, and basically it's effective and it kind of targets the underlying cause of the pain. Because if you look up, they do not, the medical profession does not say what causes headache. They don't know. They think this might be it. We're going to block this receptor, block that receptor. Great, but the end of the line is people still suffer. They don't have to be. So we're going to explore six good reasons. First one is identifying the underlying cause of your headaches. I take an X-ray from the side. I just was done with a patient a while ago, and it's not a headache case, but he had a CAT scan. He said it was normal. I could show you the X-ray, and you would pick out what's wrong with it. I don't know why they can say it's normal, but the guy's had pain for 7 years because he tried physical therapy. Don't get me wrong, physical therapy is great. I'm not slamming physical therapy. A lot of times I will send people out once I get the structural stuff all in alignment. So I have no problem with physical therapy. It's a wonderful profession. It helps a lot of people. I believe in it completely. Also too, let's throw acupuncture on. Sometimes people respond to headaches with acupuncture, but it's so much better than using a drug free, using a drug to quell something. If you're not skeptical of big pharma, then you're probably not listening to this. But big pharma's got a lot of people fooled, and it's a very big merry-go-round. Just open up your medicine cabinet, see how many pills you're on. All right, so the underlying cause, what we do is we take an X-ray, cervical X-ray from the side. Neck, cervical is neck, 7 vertebrae, typically, sometimes more, sometimes less. You have a curve, and the curve allows the weight of your head to be supported by these bony elements behind the spinal column. Okay, so it's like a pillar. Okay, and they go all the way up and down. You got them all throughout the whole body, and this seven in the neck, 12 in the thoracic spine, 5 in the lumbar. So you get your pelvis. So you lose that curve. What happens is the pressure on the disc is increased, and you can have wearing away of the disc, which is arthritis. Okay, and then you have the muscles getting tighter in the back. Okay, you're losing the spacing. The disc is the cushion. You lose the disc, it's arthritis. But you're more likely to lose the disc height when the shift is on, that the bones aren't supporting the weight of the head properly. Still has to support, so it goes to muscles. Muscles freeze up, spasm, aches, pains, and pulls on the vertebra, making it even worse. So underlying cause is called a subluxation. And now if you have a subluxation, that's what a chiropractor fixes. That is actually, it's really probably, you can that's all we really do, fix the subluxations. Unfortunately, there's a lot of people who walk around with them that don't have a clue, and a lot of that's because the medical profession does not. Well, the medical profession doesn't believe in chiropractic. And listen, it's up to you. You decide what it is you want to, you know, I don't know. My medical, when I was a kid, my medical doctor told me to become a garbage man. And I said, instead, I worked on Wall Street for 6 years before I said, I really do want to become a chiropractor. Anyhow, so we find out where you have these subluxations and we restore the natural curves. We use physical therapy. We use different exercises like home stretching. Um, but headaches can be caused by a lot of different reasons, like stress, poor posture, these misalignments of the spine. We call the subluxation. And basically, we're the only people really trained to fix these things. So if you're having headaches, and we identify the cause of your headaches coming from these subluxations in the neck, it's pretty good. It's a pretty good chance you're going to be feeling a lot better. So the next thing, we got to target the source. Sometimes you could have a muscle. You're going to have a lot of times muscles involved. These muscles in the neck are not very big, but they have to do a lot of movement. When you think of how you turn your head up, tilt your head to the left, turn right, up, down, sideways. All there's a lot of different motions. It all requires muscles to work. And if you have these bones out of place, it causes big problems. As a matter of fact, the occipital bone, if you just put your hand in the back of your head and you feel where the back of your head meets the top of your spine, that's the occipital bone. That can subluxate and cause a lot of headaches. As a matter of fact, I see it an awful lot because at that point you still have the brain stem. So the brain stem comes down to there. So besides the spinal adjustment that we do to treat the subluxation, we do use massage therapy, stretching exercises, physical therapy, like, muscle stim, laser, traction. So there's a bunch of different therapies to make the person heal faster. And I think they're very effective, and it does, again, cut down on the overall time. Um, Now, the big thing that people don't realize is your nerves control every function of your body. I hope I'm not telling you something you didn't know. But if you have all these different nerves in your body and they're not getting the communication from the brain, your nervous system function is not what it could be. And let me just, since I'm fresh with another patient just a little while ago, he's a guy who's had pain for 7 years. Of course, they said there was nothing. They didn't see anything on the CAT scan. He did a year of physical therapy. He did a lot. He's not a slouch. I know he's trying. And he's also got stuff that they're not putting together. He's got the nerves that go to your intestines come off your low back. Okay. And so what happens is now he's starting to get gas and bloating. But here's a guy who eats well, shouldn't have these symptoms. He still exercises even though he's got bad back pain. But he's trying. But chances are, that's coming from what we call the subluxation because the nerve going to his intestine is blocked. So how does the brain talk to the intestine? The brain controls every function of your body. Again, if I'm telling you something you never heard before, hit the dislike and just get off the podcast now. But the nervous system is really important to maintain the integrity, and that's what we do as chiropractors, to maintain the integrity of the nervous system. And the adjustments do that. We remove the interference, the nerve interference, in a very non-invasive way, and non-invasive in a drug-free way to help people manage their headaches. And you'd be surprised. I mean, it's one of the favorite things I can do treating-wise is treat people with headaches. That's clearly one of my favorite things. If you got questions, I'm going to say it again at the end, but give us a call, 203-656-3636, 203-656-3636. Give us a call and see for yourself. I mean, if you have questions, I'm more than happy to answer them because, you don't have to live in my area. I mean, I'm more than happy to refer you. There's a lot of good chiropractors out there. So, another reason why you see a chiropractor when you have headaches, it helps when you kind of reduce the inflammation, tension on the muscles and the nerves. Not kind of, you do. When the bone is leaning on a nerve, especially suboccipital nerves, or you have a misalignment at the base of your skull, where I said before, where you meet the top of your spine, the back of your head, and the top of the spine meet, the brain stem is there. Your brain doesn't stop in the side of your skull. You have the brain stem. Like think of you held a bunch of flowers in your hand by the stem. That's right there. So when you have those subluxations there, you can have some serious problems. So this is where So basically, by making certain things like lifestyle changes, home exercises, chiropractic care, we're able to get people over the hump with the headaches. It's a holistic approach, and kind of like, I had a patient recently came in for hip pain, and but I ask everybody if they have headaches. A lot of times people just don't equate the fact that chiropractic is actually to fix headaches. So she came in and she wasn't responsive. I had to send her off an MRI. It turns out she has a hairline fracture of the hip. I couldn't treat that, and it's nothing I'm going to do for a fracture. It doesn't make sense. It's not a chiropractic condition. But the headaches were, she goes, and but yeah, that's just, well, my headaches have gotten a lot better. She's had headaches for years. She does like some crazy $6,000 a month thing but she still got headaches. $6,000 a month, but she still gets headaches. Imagine that. So, the headaches went away. So it was like, well, I couldn't fix her hip. I was able to fix her headaches. So it's kind of fun to do that. And that's where, and holistically, so it's not a bad, chiropractic is a really good way to work on headaches. And you owe it to yourself to at least give it a try. It doesn't have to hurt. People always think chiropractic is going to hurt. If you're done properly, it doesn't hurt, but anyhow, a couple questions. How many sessions typically needed to see results for headache relief? I would have to say, I would say you need to see a 50% improvement within 4 weeks. 4 weeks of active treatment of 2 to 3 times a week. Because if the person doesn't see results in that time frame, chances are they're not a good candidate for chiropractic care to solve the headaches. Listen, we don't get everybody better. I'd like to say so, but I wouldn't. So we can't really tell you how many sessions you need, but typically we start with a modified treatment program, and then we work it there. And again, as soon as someone starts to respond, we cut them down. But there are different therapies we'll do. There's different migraines are something that to people these days. Migraine can be confusing. I mean, a true migraine, you have different like auras where you may see something visually, or even sense of smell, light changes. They do exist, and basically, anybody with a bad headache calls it a migraine. That's basically what you're gonna do. So, and the same thing too is a lot of times that's where I see the occipital bone, which is again the back of your head and top of your spine when they meet. That's a problem because it impedes the transmission flow through the spinal column at the brainstem level. So that's kind of what you know. So, and this is actually a really good question we got. Is chiropractic care safe for pregnant women experiencing headaches? Hell yeah, because you can't take medication. And I mean, bad enough you have pregnancy stuff to deal with. You don't really want to, be dealing with as far as, when you're pregnant. It's just, So, can chiropractic care help with all types? Yeah, I would say all different types of headaches. You don't know until you try it. You know what I'm saying? Like I said, a bad headache may or may not be a true migraine, but everybody with bad headache calls it a migraine. Just like everybody with wrist pain calls it carpal tunnel. It's not always true. Let's see. Is chiropractic care safe? I'm sorry, I'm repeating myself. Just reading the list of questions that we have here. How does a chiropractic compare? Medication, massage therapy. All right, medication covers things up. So how does the chiropractic compare? The idea is to address the underlying cause, which is the subluxation. If we determine that that's what's going on, if you don't have a subluxation, you're not a good candidate for chiropractic care to relieve your headaches. Massage, I would say, is a big one. We do a lot of it here in the office because one goes hand in hand with, in a big way, it goes hand in hand the soft tissue component, because when the muscles have to work harder, you need to address it. So massage is a great way to loosen the muscles up. I do want to warn you, if it's done too soon at the wrong time, it could be more problematic than anything else. I really don't want that. So that's the thing is, how does chiropractic? Okay, we're just. I'm sorry, it was the same question. All right, listen, it's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Yes, hopefully I gave you some compelling reasons to see a chiropractor for your headaches, your bad headaches. Any headache's bad, so call a migraine, call whatever you want. All right, thanks for listening. Have a great July 4th, and we will talk to you soon. Again, Dr. Brian McKay, 203-656-3636. Give us a shot.